Continuing our discussion on CSF analysis. In CSF protein electrophoresis, 4 bands predominate: transthyretin, albumin, and 2 distinct transferrin bands. The second band of transferrin is known as the tau protein, and it's specific for CSF. Faint bands of alpha-1 antitrypsin and IgG are possible. Electrophoresis is performed to identify oligoclonal bands that are present in CSF but absent in the serum in multiple sclerosis. There are other conditions with oligoclonal bands in CSF, but they have them in the serum also. This is an illustration of cerebrospinal fluid protein patterns using high-resolution electrophoresis. On the top, figure A, is a normal cerebrospinal fluid protein. The presence in the beta-2 region of transferrin, a protein unique to cerebrospinal fluid, is noteworthy, and you expect that to be present. B is an abnormal cerebrospinal fluid protein, demonstrating the presence of oligoclonal bands in the gamma region. These bands will not be present on electrophoresis of the patient's serum. TTR transthyretin was previously called prealbumin, will be present. And oligoclonal bands are defined as at least 2 bands seen in the CSF with no corresponding band present in the serum. Myelin basic protein is a lipid substance which surrounds 70% of the nerves, and this substance is necessary for proper nerve conduction to get the signal from one nerve to another to another. The remaining 30% is myelin basic protein. In multiple sclerosis and other demyelinating diseases, the myelin sheaths undergo degradation and release the protein into the CSF. When this occurs, the nerves begin to lose their functionality. Testing is done to monitor the course of the disease or, in some circumstances, to diagnose it. CSF glucose is in dynamic equilibrium with plasma. The values reflect plasma values at 30 to 90 minutes before CSF collection. The normal value for a CSF glucose is 50 to 80 milligrams per deciliter, which is 60 to 70% of that found in the plasma. Increased levels may be due to hyperglycemia, high blood sugar, and traumatic punctures. And these really have no clinical significance. Decreased glucose values are clinically significant, and they're associated with many conditions, including hypoglycemia, low blood sugar, meningitis. 50% or more will have a low CSF glucose, and this assists when you have a high protein and a normal glucose that an infectious agent may be present, and metastatic tumors. Microscopic examination of CSF can provide rapid presumptive diagnosis in 60 to 80% of the cases. This requires that these slides be observed by skilled microbiologists. It takes experience in order to be able to differentiate the microorganisms that may be present on a slide. You can either use a routine smear on a slide or a cytocentrifuge sample to concentrate the sample. Microscopic examination includes gram stain, India ink, and wet mounts. You've all taken basic microbiology, so you should be intimately familiar with the terms gram-positive and gram-negative. A gram-positive organism will appear as dark violet or purple, as indicated at the arrows in Figure 2. Gram-negative organisms will appear red or pink from the counter stain, as illustrated in Figure 1. In Figure 1, it's a gram stain of N. meningitidis in cerebrospinal fluid with associated polymorphonuclear cells. On Figure 2, we have a gram stain of strep pneumoniae with white blood cells. In the Indian ink stain. This stain is primarily used for assisting in the diagnosis of the organism that causes cryptococcosis. And the name of the organism is Cryptococcus neoformans. This causes a subacute or chronic fungal infection. And the purpose of the Indian ink preparation delineates the large capsule of C. neoformans, and the capsules appear as clear halos on a dark background. This procedure is going to the wayside and is being replaced by antigen testing, which can specifically identify this organism. Some microorganisms are resistant to routine stains. An acid-fast stain has chemicals which allow the stain to penetrate. A non-acid-fast organism will appear as a blue color as indicated by the arrow from A. If it's an acid-fast organism, it will appear bright red to intensive purple as indicated by the arrows for B. Naegleria fowleri causes primary amoebic encephalitis. The organism is found in warm freshwater areas and infects those who play or spend time in these waters. Fortunately, the infection is rare but deadly, and diagnosis is usually made at autopsy. And in Texas, we unfortunately have 1 or 2 cases of this per year. After a rain, a child was playing in the bar ditch, and what can happen is if you fall and water is forcefully pushed up your nose, that's how the organism gains entry to your brain. Like I said, there's a number of cases, and in Texas, whenever you jump into fresh water during warm weather, hold your nose or blow air out so water's not shoved up your nose. The methods of detection, you can observe a centrifuge sample or a wet mount to observe actively moving trophozoites. And I encourage you to go out on the internet and find a little video that shows the movement. A right stain smear of a cytocentrifuge sample, you can also see the trophozoites, but of course they're fixed on the slide and they're not moving. And polymerase chain reaction tests are now available for a confirmatory diagnosis. CSF cultures are used to detect the bacterial cause of meningitis. So the sample is plated on agar, and then after a period of time is observed for growth. The most common organisms involved include Haemophilus influenza, Neisseria meningitidis, and Streptococcus pneumoniae. There are numerous other bacterial, fungi, parasites, and viruses that may be the causative agents of meningitis. With CSF culture, this enables identification of common types of bacteria in 80 to 90% of the cases. It's important to note that starting antibiotic therapy before doing a culture significantly reduces the chances of recovering the bacteria, because antibiotics kill bacteria, and if the organism that we're looking for is killed by this antibiotic, then we will get a false negative on the culture. So CSF samples should always be collected prior to the start of antibiotic therapy. Immunologic methods for the detection of microbial antigens are used to assist in identifying bacterial and fungal antigens in CSF. These techniques include co-agglutination, latex agglutination, immunoassay, and counter-immunoelectrophoresis. Reagent antibodies are added to CSF and they will bind to the microbial antigen if present. And the sensitivity and specificity of these different techniques vary with false positives and false negatives occurring. For neurosyphilis, a BDRL test is performed. There's another type of test for syphilis that can be performed called the RPR, but in general, this test is not used for CSF. Spend quality time with your textbook. Review the presentation again if you need. Fill in your objectives, and if your questions are not answered,